Oh, thank you for attending our webinar. My name is Banky Fagbemi. I'm the Marketing Director at Circular Genomics. Pleased to introduce you to our webinar titled MindLight Antidepressant Response Test, Evolving the Standard of Care for Depression, Improving Patient and Practice Outcomes in Depression Care. And I'm pleased to introduce you today to our speaker. Our speaker, Dr. Nikolaos Mellios. He's the Chief Scientific Officer and co-founder of Circular Genomics. Dr. Mellios comes with a breadth of experience as a leading expert in circular RNAs and brain disorders. He developed the circular RNA technology platform that is the basis of the MindLight Antidepressant Response Test during his tenure at the University of New Mexico Department of Neurosciences, where he led the research on the role of circular RNAs in the control of molecular networks related to psychiatric and neurological disorders. Before his time at the University of New Mexico, Dr. Mellios was a postdoctoral researcher at MIT, working on pioneering RNA neuroscience research. He has a PhD in neurosciences from the University of Massachusetts School of Medicine and an MD from the University of Athens Medical School. Over to you.
Thanks so much, Banky. So this is a disclaimer. As Banky mentioned, I'm the co-founder and chief scientific officer for Circular Genomics and a board member. So something that we all have really experienced in the last decade is a significant increase in the prevalence of major depressive disorder. There was a significant uptick during the pandemic, but even after the pandemic, the rates of depression remain very high, with close to 1 out of 4 of adults developing and experiencing symptoms of depression in their lifetime. So as a result, depression now is really a global health priority. There are existing treatments, as you might have heard. There's different kinds of antidepressants that are available for treatment, but each one of these different treatment options only works in a subset of patients with depression. So for example, as you will see also in some of the slides that we will present downstream, around 60% of the patients, they will fail the first line of treatment, which is SSRI antidepressants. As a result of this trial and error approach, we have more than a year in delay for patients to see some effective therapy. And that's, in our opinion, is something unacceptable and a major driver for us to develop novel technologies that can give the physician the proper precision medicine information to guide each patient to the proper therapy. So again, as we mentioned before, a first line of treatment will be the SSRI antidepressants. Usually physicians, they will prescribe one SSRI, then they will probably prescribe a second one, and they will monitor the response of the patient during weeks and months. The problem with antidepressants is that it takes a couple of weeks for them to work and for physicians and patients to realize that this medication is working for me. However, their side effects appear very early on and they will dissipate during the weeks of treatment. So this is really difficult where you have initiated a treatment for a specific patients and you only have a small subset of patients responding, and you will only know that a few weeks or months after treatment. When a patient fails to respond to the first line of treatment, they're usually prescribed SNRI, atypical or other second and third class antidepressants, and then they repeat this process, wait and see, wait for weeks and months, see if the patient is improving. And overall, I think this is a significant delay for a devastating disorder such as depression. And in addition to the patients that will actually achieve response after second and third line of treatments, there is unfortunately a 30% of the population which are called treatment-resistant depression, and they will not respond to any kind of treatment. These patients usually they will be prescribed 3, 4 or more lines of treatments, and then after an average 2 years of failures, they will be guided to additional treatment options such as TMS, ketamine, and other therapeutic approaches that are reserved. So as a result, you can understand that this whole workflow is something that really needs improving, and this is where we are really committed to significantly disrupt in a positive way and provide to the physician for the first time unique and precise tools to guide decisions on treatment for each patient. So how are we able to do that? And what is the technology and the biomarker that is allowing us to provide this precision approach for a brain disorder and a complex brain disorder such as depression? So we focus on circular RNAs. Circular RNAs are RNAs that are expressed within our own body. They're particularly enriched in the brain versus any other tissue. And because of their closed loop structure, they're very resistant to degradation. So that means they're able to circulate outside of the brain, escape the blood-brain barrier, and be readily detectable in the blood. So for the first time, we're able, with techniques such as RNA sequencing and PCR, to look at biomarkers in the blood that are coming from the brain and have an indirect window into processes of the brain. And as we'll explain in some of the next slides, as we show you some results from our own clinical studies, different circRNAs from the brain, they are specifically sensitive to different receptors being activated, to different changes in neuronal activity and function. So that allows us to have a large repertoire of brain-derived molecules in the blood that can really reveal different layers as far as diagnosis, risk of developing a disease, and response to treatment. We were able to work with lead academic institutions, both in the US and abroad, and we worked with very well characterized antidepressant response studies, such as, for example, the EMBARK antidepressant response study that was led by Dr. Madhukar Trivedi, a member of our scientific advisory board, and a lead expert in precision psychiatry. So it involved the 4 different clinical cohorts, one from UT Southwestern, Harvard Medical School, Columbia University, and University of Michigan. So this large study involved collection of blood samples before and after treatment with sertraline, which is the most commonly prescribed SSRI antidepressant, and also included additional treatments such as placebo treatment, treatment with bupropion, and a typical antidepressant. So what we are showing you here on the right is just a high-level summary of the results of this study, where we found that the specific brain-derived circRNA that we detect in the blood was differentially expressed in patients that responded and did not respond to sertraline treatment. So you can see, for example, that patients that were non-responders to treatment, at baseline, they have significantly elevated levels of the circular RNA, versus patients that were responders to treatment, they have low physiological levels of the circRNA biomarker. In addition to these results that we independently validated in additional clinical studies, we found that this biomarker is highly stable in the blood, is not affected by different times of the day, is not affected by whether the patient has eaten lunch or other daily activities. It's a really reliable and robust biomarker. However, there is a single event that triggers a significant change in its expression in the blood, and that is the initiation of treatment. So this is highly specific to initiation of treatment with SSRIs. It does not change with treatment with bupropion, placebo, other medication, and it does not predict response to any of the other classes. So this highly specific biomarker in the blood not only is differentially expressed before treatment and allows us to predict which would be the responders and non-responders to SSRI treatment, but also after treatment, it exhibits significant changes that are indicative that this is a major molecular component of the effects of antidepressant response. And this leads to our next slides. A lot of our animal mechanistic studies have revealed that, have revealed that this circular RNA that we use to predict SSRI response is activated within the brain by 2 very important pathways. So as of course you might know, SSRIs, they increase the expression of serotonin within the synapses of the brain, okay? So they achieve that by blocking the reabsorption of serotonin through the serotonin transporter. So the first pathway that is activated when someone is under SSRI treatment is the serotonin pathway and the different receptors that mediate their effects. So what we found is that the circRNA that predicts specifically the likelihood of someone responding to SSRIs is activated within the brain by the serotonin pathway. And of course, serotonin itself could be used as a biomarker, but peripheral levels of serotonin in the blood are coming from the gut and other peripheral sources. So serotonin is not able to escape the blood-brain barrier. However, our circRNA is able to do that. So it gives us a direct line to the serotonin pathways within the brain. In addition to this important pathway, for SSRI antidepressants to work, and to achieve a response and remission to treatment, they need to activate a secondary pathway. It's called the neurotrophic brain-derived neurotrophic factor signaling, BDNF. BDNF is a known neurotrophic factor, increases in our brains when we exercise, when we use our brains, and so on, and protects neurons overall. But in the case of depression, BDNF needs to be activated within a couple of weeks and days of treatment. And actually, this is what we found as the second component pathway that is associated with our circRNA biomarker. We found that it's also activated by the BDNF receptor signaling. So in a way, this circRNA seems to be specifically connected to both pathways that are of significant relevance to the mechanism of antidepressant response. So for the first time, we have a brain-derived biomarker strongly linked to known mechanisms of antidepressant response that we can readily detect in the blood and provide this highly precise prediction of likelihood to respond to SSRI treatment. This is a little bit of information about the actual assay, the MindLight Antidepressant Response Test. It's indicated for adults that are suffering from depression, and it's able to, as I mentioned before, to sequester patients before treatment and in those that are high likelihood to respond and low likelihood to respond to SSRI therapy. And we will dissect further what this could mean for the physician to have this information a priori before they initiate treatment. We're going to give you information also about the clinical portal and how we provide access to this assay. But before we move to some additional information, we want to mention that this is a CAP-CLIA laboratory developed test. We have a laboratory in San Diego that performs this test, and this has been gone extensive analytical validation studies that further highlighted the robustness and reproducibility and precision of this assay. It's a PCR-based assay, as we mentioned, and it detects a single circRNA analyte that has to do with predicting SSRI response. So this is, for example, an example of a test report for a patient that has been identified to have high likelihood to respond to SSRI treatment. So patients that are identified as high likelihood to respond to SSRIs in our clinical studies, they have shown close to 80% chance of responding to treatment. We believe that this is a significant differentiating factor because without any precision tools, patients usually have a 40 to 50% chance of responding. So that would be a significant increase in the percentage of success. So a physician can actually pre-select the individuals that are high likelihood to respond to SSRIs, and if they believe, according to additional indications and additional clinical information, that they could be prescribed an SSRI, choose to go as a first line of treatment with SSRIs and have a significant percentage of these individuals achieving response. The other report that we can provide is the exact opposite, a patient that has low likelihood to respond to SSRI treatment. So in this case, again, it's always up to the physician to make the final decision, but knowing a priori that the patient has low likelihood to respond, in which case, again, it will be only 20% chance of responding to SSRIs, that will guide the physician to actually start thinking about alternative treatments immediately, not wait for months to fail SSRI treatment, but initiate second and third line of treatments, SNRI, atypical antidepressants, or other choices that would only have been reserved at a later stage in the medical workflow after the patient had failed the treatment. So here is a little bit of comparison to what we mentioned before, the current standard of care. As of now, there isn't really any other tool or assay to make this accurate and precise prediction of response to treatment for SSRIs or other antidepressants. So as I mentioned before, without any precision guidance, close to 40% of patients will only respond to SSRIs and 60% will fail treatment. And then sometimes that could be one or two different SSRIs given in a duration of a few months. Where our assay, we're able to increase the likelihood of a patient to respond to SSRIs to close to 80%. And inversely, knowing that someone is low likelihood, we know that they will only have a 20% chance of responding to SSRI. So that creates a very significant differential, and then of course promise to have a very significant impact in how soon can a patient achieve response and a remission to treatment, which in addition of course to the main objective, which is to alleviate this really devastating disorder and help patients get better sooner, it also entails significant economic benefits, including an economic modeling study that we recently performed with Harvard Medical School, where it highlighted savings close to $1,500 just in the healthcare system for utilizing our assay, without even mentioning, of course, additional savings as far as productivity and, of course, the patient being able to go back to work the sooner possible and have alleviation of their symptoms. So we believe this is something that will revolutionize how psychiatrists and primary care physicians treat major depressive disorder, and will perhaps initiate a cascade of other approaches for precision medicine into psychiatry, which is much needed. All right, we mentioned some of the advantages in the previous slides, but let's go over some of the benefits for physicians. First of all, of course, is the streamlining of the treatment plan. As we mentioned above, choosing the right drug for the right patient at the right time. And of course, that can have significant improvements in the operational efficiency. Above and for all, this is for us our main driver and our main passion to be doing all this significant work, is the improvement in the patient's quality of life. Depression has very significant impacts in a patient's quality of life. It's actually a leading cause of disability worldwide, and it impacts a lot of the patient's loved ones. And it has a significant impact, as we said, in their productivity and their work balance. So for us, this is the significant benefit, of course, to the patient themselves. But because of physicians implementing this approach and having a patient that responds sooner, saving costs for them and the healthcare system, that also, of course, can enhance the reputation of physicians, especially given a lot of misinformation around antidepressants. Having a specific plan that is evidence-based and showing to the patient that this is why they're choosing the current choice of medication can increase compliance for the patient. And of course, additionally, it can increase the belief for the patient that the physician is actually doing the best they can for this very devastating disorder. And as a result, of course, we mentioned the benefits to the patients, the physician-patient trust, and most importantly, shortening the time frame to finding an effective treatment. All of these benefits that we're mentioning in these slides, they don't even take into account the very significant indirect comorbidities associated with depression. A patient that has major depressive disorder that is not properly treated for years can actually have significant predisposition to cardiovascular disorders, other neurological disorders. So definitely, this is not just the immediate alleviation of depression, but also long-term care of the patient and reducing all the other comorbidities that come hand to hand with this devastating disease. This is some information about how the assay itself can be prescribed. So, for example, once a physician is interested, the MindLight test collection kits can be provided to their practice. The patient can, depending on the choices of different offices and different clinics, they can either be withdrawal of blood at the location of the physician's office or clinic, or we can arrange for a phlebotomist at a local lab to collect the blood. And in this case, we use the MindLight test requisition form that can guide the patient to go to local and partnering lab for the blood draw. And of course, once we have the process ongoing, we use a very secure online portal for accessing to information, ordering, and receiving results. And of course, always these are results that are indicated to the physician, and the physician goes over the results with the patient and makes themselves the decision on the next treatment for its patient. So I think we're nearing the end of this presentation, but it's important to mention that this assay is able to deliver this high and low likelihood precise reports to physicians very fast. Within 5 days, 3 to 5 days a week from start to finish, the physician can have this very straightforward report indicating the likelihood of response, and then together they can decide on what is the most accurate treatment for their patients. So I'm gonna finish here for any questions by Banky, and encourage you to go to our website to explore the possibilities about MindLight.
Great. Thank you very much for that informative discussion, Nico. That was very helpful. So again, just to reiterate, if you're interested in ordering MindLight, you can reach out to our customer service. The email is shown on the screen, customerservices@circulargenomics.com, or you can go to our website and there are forms you can fill if you're interested, and we will reach out to you. So, thank you for that great presentation, Nico. We have a few questions here for you.
Mhm.
So the first one is this, so audience member says, I currently order pharmacogenomics testing for some of my MDD patients to guide management. How does MindLight differ from PGX testing?
I think that's an excellent question. So pharmacogenomics testing looks at the DNA to look for potential mutations that could impact the metabolism of drugs, including antidepressants in the liver. So knowing metabolism of drugs in the liver could be useful potentially for predicting side effects and tolerability of drugs. However, in numerous clinical analysis and also the opinion of the FDA and the American Psychiatric Association, it lacks clinical utility for directly predicting response. In other words, just because a drug is properly metabolized in my liver, it doesn't mean that in my brain it will activate the proper pathways that are needed for antidepressant response. And again, with each patient having a variety of pathways that will be more appropriate for them. So what our assay actually does, it has this direct brain-derived biomarker that is directly associated with antidepressant response. So unlike PGX, it can provide this prediction of what is the likelihood to respond to this line of treatment.
Great. Thank you for that. Next question. Does MindLight report on other antidepressant classes outside of SSRIs? For example, can I get information on a patient's likelihood to respond to SNRIs from MindLight?
Yeah, that's a good question. So MindLight is only specifically reporting to the likelihood of response to SSRIs. Our multiple clinical studies have highlighted this is a highly specific biomarker for antidepressant response for SSRI class. So, however, of course, if a patient is under treatment with an SNRI, and it's not working for them, this is something where the physician could order our assay to determine would SSRIs be a better alternative for them. But yeah, it's a very specific for the SSRI class.
Great, thanks. All right, next question. What is the accuracy and clinical utility of the MindLight test?
Yeah, exactly. So as we mentioned above, this is a highly accurate test. It's close to 80% positive predictive value and negative predictive value. So in other words, if we identify someone as high likelihood, it will be close to 80% that they will respond to SSRIs. If low likelihood, it will be the inverse, 20% to respond, 80% to not respond. Again, this is something that we never had this kind of precision in mental health and depression treatment. And as far as, of course, the clinical utility, we covered it above. For the physician having access to this tool before initiating treatment, it can save significant months or years from achieving response and remission for his patient. And because depression itself is a disease that is highly taxing to the individual, the society, and it has very significant costs to the healthcare system. There's also a significant economic and quality of life utility for utilizing MindLight.
So that actually is a very good segue into the next question, which is there any data, or do you have any data or studies on the economic cost savings outcomes from utilizing MindLight?
Yeah, so we conducted a study with Harvard Medical School where we modeled the potential savings after use of MindLight in the clinical practice. So that was an independent study conducted by Professor Roy Perlis from Mass General. And this is something that we will prepare as a peer review publication. But the initial findings from the study indicated that the use of MindLight can lead to close to 1,500 per year per patient savings to the healthcare system. So that would be savings to insurers, healthcare system, clinics, and again, not even counting the additional savings, as we mentioned, for the patient, quality of life, productivity. So we think that's a very notable component. So we believe that this is a significant aspect that physicians should be looking at.
Great, great. So now we also have two more questions that are related more to the circular RNA technology. So the first one being, how much research has been done on circular RNAs as biomarkers and mental health?
Yeah, that's an interesting question. So circular RNAs actually were serendipitously discovered much earlier, 1979, 80. where they were accidentally discovered, oh, there's these circular molecules that are expressed in our cells. But as always, with this kind of initial treatments, it took a number of decades. And at around the 2000s, from 2000 to 2020, there was a significant number of publications understanding clearly what is their function, how do we detect them in different tissues, and of course biological fluids. And there's really an explosion in research in psychiatry and neurology in the last 7 to 10 years, where highlights that these molecules are so important for brain development, maturation, aging. They're capable of detecting, very small changes in brain activity, different receptors being activated, and they're actually implicated in a number of other psychiatric and neurological disorders, including Alzheimer's disease, bipolar disorder, and so on. So we have now just barely scratched the surface to the potential of circular RNAs, but again, starting with prediction of antidepressant response, we believe is one of the most significant unmet needs in psychiatry.
Great, great, thanks. And one last question. What do we know about the specific circular RNA that MindLight analyzes and reports on?
Yeah, I mean, of course, always we mention that a biomarker doesn't necessarily need to be mechanistically linked to a disease, but in this case, this specific circRNA is actually pretty well understood as far as what is its function in the brain. It's extremely highly expressed in the brain. Is very little source outside the brain. And within the brain, the circRNA is really intriguing. It regulates how neurons fire, how neurons talk to each other and communicate to each other. And it regulates a very important mechanism called brain plasticity. Our brain really adapts to different stimuli, changes in activity, and it's able to homeostatically regulate its activity and connectivity. So we know, for example, that in depression, one of the main hypotheses are that depression is actually a consequence of different brain regions not being properly connected and neurons within these brain regions not firing in an orchestrated manner, right? Imagine you have to play a complex symphony, right? And you're an orchestra. So then if some of these neurons, some of these pathways, they're not performing appropriately, it will collapse and you won't be able to play a very complex tune. The same thing with brain function and plasticity. So this is really interesting component, and this unique circRNA is able to regulate brain plasticity. So that's why we believe it's able to predict who's going to need SSRIs and who's going to respond to SSRI treatment. We believe it's predicting who has a deficiency in serotonin and neurotrophic signaling pathways and who is able to activate these pathways after treatment. So that goes to a lot of the ongoing conversations that not every patient with depression has a deficiency in serotonin, right? Every patient will have its different deficits leading to depression. So this is a very exciting biomarker, and we're conducting additional studies to further understand it and also explore its potential for future treatments in depression.
Great, very, very exciting indeed. Thank you so much for this informative discussion, Nico, and thank you to our audience for attending today.
Thank you, Bucky. And if anyone wants to contact me or anyone in our company for further questions, we'll be available for that.
All right, thanks.
Thanks.